Every day, millions of women across the country face the challenges of navigating a healthcare system that often ignores their unique needs. A young girl just beginning her journey into womanhood is left to figure out her first period without any guidance or support. A woman in her 30s suffering from chronic menstrual pain is brushed off by her doctor, leaving her to struggle in silence. And a grandmother entering the uncertainty of menopause is met with confusion and outdated advice from the very system that should be helping her. These are not isolated incidents. They are a reality for far too many. They show us that for many, access to comprehensive and respectful reproductive health care remains a distant dream, not a guaranteed right. In the United States, over 19 million women live in a contraceptive desert, areas where little to no access to affordable reproductive health care. Yet the problem goes deeper than contraception or abortion. It spans from puberty to menopause and touches every stage of life in between. Access to comprehensive reproductive health care is essential for individual well-being, public health, and social equality. Yet for far too many, we face significant barriers that prevent them from receiving care that they need. Therefore, these barriers must be addressed to protect public health, social equality, and individual body autonomy rights. Today, I'll show you the barriers millions face, the consequences of these gaps, and how we can work together towards solutions. Reproductive health care is about more than birth control, abortion, or sex. It's about education, hormonal health, and access to care across a lifetime. From puberty through menopause, countless women face a lack of adequate support for medical attention. For example, as highlighted in a report by the Association of American Medical Colleges, women were still being systematically excluded from some clinical trials as recently as 2019. According to the AAMC, this has perpetuated a one-size-fits-all approach in medicine, often overlooking conditions like heart disease and hormonal imbalances that disproportionately affect women. As a result, women often experience a troubling trend of misdiagnoses and delayed care, which leads to serious health consequences. Additionally, many women lack access to menopause care or hormonal therapy, essential resources that can significantly improve quality of life during the phase of that time of life. The AAMC also emphasizes how young girls entering puberty are frequently left without adequate education about their changing bodies, leading to confusion, fear, and missed opportunities to address critical health needs. The systemic neglect isn't just an inconvenience, it's a public health crisis. Women are more likely to be dismissed or gaslit by providers, often being told their symptoms are just in their heads or left without actionable solutions. Medical gaslighting has affected many women, and I experienced it firsthand with my own health. For over a year, I struggled with severe blood loss due to a growing fibroid, but my primary care doctor dismissed it as just heavy periods. It wasn't until I passed out in a retail store that my mom took me to her own gynecologist, who immediately diagnosed me with this fibroid instead of heavy periods, and I had a grapefruit-sized uterine fibroid. The fibroid caused such significant blood loss that during the surgery to remove it, I needed almost half of my blood replaced through a transfusion. This experience alone was a stark reminder of how easily women's health concerns can be ignored and why we need better medical attention, particularly for reproductive issues. Dr. Funmi Mackind, a health equity research analyst with the AAMC, emphasizes the urgency, stating, "Inequities are so pervasive and persistent that they require multi-sector efforts to address not just healthcare, but the broader societal factors that contribute to these disparities." Access to comprehensive reproductive health care is not equally available, especially for marginalized communities. As the National Institutes of Health 2018 notes, Black women, American Indian women, and other women of color are more likely to experience complications, morbidity, and mortality related to pregnancy than white women. These disparities are driven not only by biological factors, but also by structural inequalities such as limited access to quality health care, socioeconomical challenges, and racial discrimination. According to the NIH, these populations often have less access to prenatal care, family planning, and abortion services, exacerbating the disparities in maternal and reproductive health. The lack of healthcare access is compounded by insufficient education on reproductive rights and options, leading to higher rates of unwanted pregnancies and complications. As the NIH points out, a lack of research and focus on women's health in marginalized communities only perpetuates these inequalities. Improving healthcare access and addressing racial and ethnic disparities can empower these communities, providing the necessary care and education to make informed reproductive health decisions. These barriers are not just statistics, they have devastating real-life consequences. One of the most devastating consequences of restricted access to reproductive health care is the higher maternal mortality rate, particularly among marginalized communities. Mental health plays a significant role in this crisis, with mental health issues responsible for nearly 23% of all maternal fatalities in the US. For many women, conditions like depression and anxiety are not adequately addressed during pregnancy and postpartum care, leading to preventable deaths. The need for more comprehensive mental health treatment in maternal care remains a crucial but missing piece. These gaps in care are worsened by social factors like poverty and discrimination. Addressing mental health as a part of reproductive health care could significantly reduce maternal mortality rates and improve overall health outcomes. The lack of access to reproductive health care affects not just individuals, but entire communities, perpetuating cycles of poverty and inequality. Women, particularly from those marginalized communities, suffer disproportionately from healthcare disparities. According to PubMed Central, Black women are 3 to 4 times more likely to die from pregnancy-related complications than white women, highlighting the severe racial inequities in maternal health. Limited access to contraception, abortion, and prenatal care increases health risks and limits women's ability to contribute fully to society, whether as students, workers, or caregivers. This issue extends beyond the personal level. It's a societal one. PubMed Central also highlights that racial and ethnic inequalities in maternal health outcomes are attributed to social determinants of health access to care and implicit bias in healthcare settings. These factors prevent women from thriving and exacerbate broader social inequalities. When you have a free evening, I encourage you to watch the documentary Aftershock, which poignantly highlights the devastating impact of systemic racism, showing how Black mothers are disproportionately affected by maternal health crisis. Hulu describes Aftershock as a powerful documentary that chronicles the devastating deaths of Black women during childbirth, highlighting how systemic racism within the healthcare system directly contributes to Black maternal mortality. These disparities deepen social inequality as Black women face greater risks during pregnancy and childbirth, and their families bear the emotional and financial burden of these inequalities. The result in increased reliance on public assistance, diminished workforce participation, and ultimately the perpetuation of poverty and inequality within these marginalized communities. These inequalities undermine the very fabric of our society, making it clear we must address access to reproductive health care as a means to combat social disparities. The good news is we can do something. Having access to reliable, knowledgeable professionals is crucial for reproductive health. The Improving Women's Health Through Evidence-Based Education article emphasizes how a lack of education leads to misinformation and negative health outcomes. Dr. Jolene Brighton is a prime example of a healthcare professional providing women with the tools to understand their health, focusing on hormone balance and advocating for better patient care. As a doula, I witnessed the profound impact personalized support that can have on maternal health outcomes. Research from Curis emphasizes the importance of this support, stating that doulas provide continuous emotional information and physical support during labor, which can result in improved maternal and birth outcomes, including reduced rates of preterm birth and cesarean sections. Expanding access to doula services is not only about compassionate care, it's about addressing systemic inequalities and empowering every individual in their reproductive journey. Growing up, I watched Dr. Ruth on late night TV, where she made uncomfortable subjects like sex education feel approachable. Her candid, informative approach to reproductive health empowered me and many others, showing the importance of having trusted resources available to make us informed decisions about our bodies. Countries like the Netherlands are leading the way with comprehensive sex education. According to Duke Center for Global Reproductive Health, the Netherlands provide sex education starting at a young age, covering topics like consent, sexual orientation, and healthy relationships. This early and holistic approach not only reduces the rates of teen pregnancies and STIs, but also fosters emotional intelligence and bodily autonomy. The U.S. could greatly benefit from a similar model, ensuring our children are well prepared to navigate their bodies, relationships, and reproductive health in a safe and informative way. Books like It's Not the Stork, It's Perfectly Normal are invaluable tools for introducing children to healthy concepts of their body and reproduction. These resources break down complex topics into kid-friendly, approachable language, allowing children to grow up with a sense of body autonomy and understanding. As the Sex Ed Rescue Review highlights, It's Not the Stork fosters healthy body image and addresses the awkward questions children may have. Starting these conversations early, no matter how uncomfortable, ensures the kids are empowered with knowledge and the confidence to make informed decisions as they grow. Now more than ever, we cannot remain passive. The disparities in reproductive health care aren't just statistics. They have real, devastating consequences for people who we know and love. This is not just a women's issue, it's a societal issue. Whether you're a woman, partner, friend, or family member, the pain of those affected by inequitable care touches us all. We must act. Vote for policies and leaders who prioritize reproductive health. Advocate for an end to discriminatory practices in healthcare, and have those uncomfortable conversations to ensure the next generation has the resources and education to make informed decisions about their health. The time for change is now. Let's not wait for future generations to face the same injustices. Together, we can build a future where reproductive health care is a right for all, not a privilege for a few. Reproductive health care is a right, not a privilege. When we fail to provide comprehensive care, we perpetuate cycles of poverty, inequality, and suffering. But when we act by expanding access, improving education, and fostering empathy, we empower generations. The solution is in our hands. We have the power to create a society where comprehensive reproductive health care is accessible to all, ensuring health, dignity, and freedom for everyone.